Hi, my name is Marvin Dule, a medical student at Kampala International University, Western Campus. With my colleagues,
my name is Elizabeth,
Dr. Amwiine Eugine,
Naziwa Joanita,
Kenneth Omoding,
are here to tell you about the World Hemophilia Day. This is commemorated every 17th of April. Yes, every year. It was set aside by the World Health Organization. Hemophilia. What's hemophilia? Hemophilia is a bleeding disorder that, when you have this condition, you tend to bleed a lot, bleed heavily, even if it's a minor trauma, even if it's a minor cut or injury. So I'll ask my doctor, Dr. Eugine, to take us through what hemophilia is deeply. Thank you.
Hello everyone. My name is Dr. Amwiine Eugine. I am a medical officer working with Doctors Case Medicals Limited. Doctors Case Medicals is a private clinic with branches in Ishaka, Rukunjiri and Chihihi. We offer services ranging from daily outpatient department services, inpatient department services. Today, the 17th of April 2024, we mark the World Hemophilia Day, and I have been approached by clinicians at service to give people a brief into the understanding of this potentially life-threatening bleeding disorder. Hemophilia is a chronic disease with no known cure as of today. However, there is medication that can be given and other forms of care that can be given to people living with hemophilia so that they can lead potentially normal lives. As the theme for this year's Hemophilia Day states, equitable health for all, recognize all bleeding disorders. Among the complications these people suffer, we have joint diseases, they suffer from bone diseases, they suffer from kidney diseases, and also some heart-related conditions as a result of this disorder. Well, how do people get hemophilia, or how does someone end up having this disorder called hemophilia? Well, hemophilia is a disease that does not transmit from one person to another, so people with hemophilia shouldn't be shunned for fear that they will give us the disease. It is a genetic disorder, meaning that someone is born with it by virtue of a certain mutation or change in their gene makeup that puts them at risk of being born with this disorder. Well, that gene that we're talking about, or that factor that makes someone to be born with this disorder, hemophilia gene, is carried on the X chromosome. Well, there are things that we call chromosomes which carry the message or the information of our genetic makeup. A male is born with an X chromosome and a Y chromosome, whereas a female is born with two X chromosomes. The hemophilia gene is carried on the X chromosome. Being that males have one X chromosome and a Y chromosome, they are commonly affected by this disorder, whereas the females who have one X chromosome and who have two X chromosomes are often protected by the normal gene that lies on the second X chromosome. Hemophilia suffer significant morbidity, and being that the condition is rare, it is often undiagnosed, especially in developing countries like Uganda. Currently, there are only 80 diagnosed cases of hemophilia in Uganda, and factors being the little funding, little knowledge regarding the condition, and since hemophilia is a rare condition, people living with this disorder, especially in developing countries like Uganda, are often forgotten. The disease is often underdiagnosed. That means many live with it without receiving the potential treatment to aid them in their suffering. Therefore, with movements like Clinicians at Service, together with us, the doctors and people out there, would like to call upon each and every one of you to join us in the fight and in aiding people living with this disorder. I'd like to call upon each and every one of you out there to join us, Clinicians at Service, in the fight in raising awareness and helping people living with hemophilia. Thank you.